So today we'll be talking about delirium tremens. This is a condition caused when patients' intake of alcohol suddenly stops. More to the point, it is a violent delirium with tremors that is induced by excessive and prolonged use of alcohol liquors. It's also called the DTs or detoxing. It occurs after a patient stops drinking alcohol. Unlike other narcotic withdrawals, DT can be narrowly traced down to physiological dependence on alcohol's two main chemical components. Those would be ethanol and methanol. Both these chemical markers function as a positive modulator for receptors in the brain, which, after long and arduous usage, creates more neural pathways to bind the chemicals. This is why, after drinking for long periods of time, stopping abruptly causes a massive systems failure in a region of the brain trying to make sense of a loss of what has been considered a vital receptor. Let's take a moment to review a video on the signs and symptoms of delirium tremens.
Hello, this is Dr. Carlo Oger, emergency physician and founder of edxitvideo.com. This video is about delirium tremens. Delirium tremens is a severe form of alcohol withdrawal that involves sudden and severe mental or nervous system changes. Delirium tremens can occur when you stop drinking alcohol after a period of heavy drinking, especially if you do not eat enough food. Delirium tremens may also be caused by head injury, infection, or illness in people with a history of heavy alcohol use. It is most common in people who have a history of alcohol withdrawal. It is especially common in those who drink 4 to 5 pints of wine or 7 to 8 pints of beer every day for several months. Delirium tremens also commonly affects people who have had an alcohol habit or alcoholism for more than 10 years. Symptoms most often occur within 72 hours of the last drink. However, they may occur up to 7 to 10 days after the last drink. Symptoms may get worse quickly and can include body tremors, changes in mental function, agitation, irritability, confusion, disorientation, decreased attention span, deep sleep that lasts for a day or longer, delirium, excitement, fear, hallucinations, increased activity, quick mood changes, restlessness or excitement, sensitivity to light, sound, and touch, stupor, sleepiness, or fatigue. Seizures, most common in the first 12 to 48 hours after the last drink, most common in people with past complications from alcohol withdrawal. Usually, they're generalized tonic-clonic seizures. Symptoms of alcohol withdrawal also include anxiety, depression, difficulty thinking clearly, fatigue, feeling shaky, headache, insomnia, nausea and vomiting, episodes of sweat or diaphoresis, palpitations, etc. Signs and tests. The following tests may be done: blood magnesium level, blood phosphate level, comprehensive metabolic panel in which doctors check the liver function tests. Also, an EKG, which is an electrocardiogram, and an EEG, which is looking for seizures. Symptoms such as seizures and irregular heartbeat are treated with the following medication.
So treatment is based on symptom management and is focused at the prevention of the progression to the seizures, which could also lead to coma and then death. Benzodiazepines help with the main signs and symptoms of alcohol, and these are given based off of a CWA score, which we'll discuss at greater length later. Patients are given fluids, electrolytes, and vitamins as needed. Please be aware the symptoms of DTs often manifest within 48 to 96 hours after the last drink, but they can occur up to 7 to 10 days after the last drink. So be aware and make sure you're assessing your patient. The Clinical Institute Withdrawal Assessment Tool for Alcohol, or CWA scoring, is a 10-item scale used to assess and manage alcohol withdrawal. The maximum score is 67. Mild alcohol withdrawal is defined as a score less than or equal to 15. Moderate with scores of 16 to 20. and severe is any score greater than 20. The 10 items evaluated on the scale are common symptoms and signs of alcohol withdrawal and are as follows: nausea and vomiting, tremor, paroxysmal sweats, anxiety, agitation, tactile, auditory, and visual disturbances, headache, orientation, and clouded sensorium. As a nurse, once the patients are past the worst of the delirium tremens, it is imperative to assist the patient back to the road to recovery. I'm going to exit this presentation now, and we're going to take a look at some of the links I provided on nursing resources. This is a CUA scale located on MedCalc. When you address your patient, you assess whether they feel sick to their stomach, have they vomited, and you score them here. Let's say our patient had intermittent nausea with dry heaves. Then we assess their tremor. We ask them to extend their arms and spread their fingers apart and look to see. Let's say that we cannot see a tremor, but it can be felt fingertip to fingertip. Paroxysmal sweats. We look at their body and see where they are. Let's say that they have beads of sweat obvious on their forehead. We ask if they have any anxiety. Do they feel nervous? Let's say our patient is moderately anxious and guarded. We ask about agitation. Let's say they have somewhat more activity than normal. Then we look at tactile disturbances and we ask the patient if they have any itching, pins and needles feelings, burning, numbness, or feel like bugs. Let's say our patient denies any. We ask about auditory, visual, and headache. Let's say our patient has moderately severe hallucinations, moderately harsh or ability or frightening auditory disturbances, and mildly sensitive visual disturbances, and has a moderate headache. Right now, we are at a 27-point score, which indicates that they will require medication for withdrawal, and it may also require admission to the ICU for observation. We haven't even finished the CUA scale. Let's say that they cannot do serial additions and are uncertain about the date. Our next steps. We're going to consider benzodiazepines and Valium and additional supportive care. I also wanted to include the Alcoholic Addiction Hotline. It's imperative for nurses to know what resources to be able to give to their patients when they witness somebody going through delirium tremens. Below is a video on alcoholism in America and resources in Austin that can help a patient get sober. Thank you.